Opcicon One-Step, also known as Levonorgestrel, is used by women as an emergency contraceptive to prevent pregnancy after birth control failure or unprotected sex. It should not be used as a regular form of birth control. It will not stop an existing pregnancy or protect against sexually transmitted diseases. It may not work well in women over a certain weight or if certain other medications have been used within the past month. It's important to talk to your doctor to see if this medication is right for you. Be sure to check the ingredients on the label, as they may have changed, and taking the wrong product could harm you. When taking Opcicon One-Step, it is important to read all directions on the product package if you are using it as an over-the-counter product. If you have any questions, talk to your pharmacist. If your doctor has prescribed this medication, take it as directed. Take 1 tablet by mouth with or without food as soon as possible after unprotected sex. This medication works best when it is taken within 72 hours, 3 days, after unprotected sex. If you vomit within 2 hours of taking this medication, contact your doctor to ask if you need to repeat the dose. After taking this medication, the time when your period comes and how much you bleed may change. Tell your doctor right away if your period is more than 7 days late. You may need to take a pregnancy test. If you think you may have a serious medical problem, get medical help right away. Some common side effects of Opcicon One-Step include nausea, vomiting, abdominal pain, tiredness, dizziness, changes in vaginal bleeding, breast tenderness, or headache. If these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to note that if your doctor has prescribed this medication to you, they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects, such as severe lower stomach pain, particularly 3 to 5 weeks after taking Levonorgestrel. While rare, a serious allergic reaction to this drug can occur. If you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help right away. This is not an exhaustive list of potential side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Opcicon One-Step, make sure to tell your doctor or pharmacist if you are allergic to Levonorgestrel or other progestins, or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. Also, before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have had unexplained vaginal bleeding. It's important to note that this medication may cause dizziness, and alcohol or marijuana, cannabis, can intensify this effect. It's advised to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages is also recommended, and if you are using marijuana, cannabis, it's best to talk to your doctor about it. Before undergoing any surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Additionally, this medication must not be used during pregnancy. If you become pregnant or suspect that you may be pregnant, it's crucial to inform your doctor right away. It's also important to note that this medication passes into breast milk, but it is unlikely to harm a nursing infant. However, it is recommended to consult your doctor before breastfeeding while using Opcicon One-Step. It's important to be aware that Opcicon One-Step may interact with other medications, potentially affecting how well it works or increasing the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some drugs may cause emergency birth control to work less effectively by reducing the amount of birth control hormones in your body, potentially leading to pregnancy. These drugs include griseofulvin, modafinil, rifamycins, such as rifampin, rifabutin, St. John's wort, drugs used to treat seizures, such as barbiturates, carbamazepine, felbamate, phenytoin, primidone, topiramate, HIV drugs, such as nalfinavir, nevirapine, among others. It's important to talk to your doctor or pharmacist for more details. If someone takes too much Opcicon One-Step, it is highly unlikely to cause an overdose. However, if someone does take too much and experiences serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting. It's important to always take medications as directed and seek immediate help if you suspect an overdose. Make sure to schedule and attend all your medical checkups as recommended by your healthcare provider. This is important for monitoring your health and ensuring the effectiveness of Opcicon One-Step. Opcicon One-Step is a medication used to prevent pregnancy after unprotected sex or a birth control failure. It contains a combination of levonorgestrel and ethinyl estradiol, which are hormones that prevent ovulation and also cause changes in your cervical mucus and uterine lining, making it harder for sperm to reach the uterus and for a fertilized egg to attach to the uterus. This medication is intended for use as an emergency contraceptive and should not be used as a regular form of birth control. It is important to take Opcicon One-Step as soon as possible after unprotected sex. The sooner it is taken, the more effective it is. It is recommended to take one tablet as soon as possible within 72 hours, 3 days, after unprotected sex. It can be taken with or without food. If you vomit within 2 hours of taking the medication, contact your healthcare provider to discuss whether you need to take another dose. When storing Opcicon One-Step, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place that's not in the bathroom and out of reach of children and pets. When it comes to getting rid of Opcicon One-Step, don't flush it down the toilet or pour it into a drain unless specifically told to do so. When the product is expired or no longer needed, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.